Hello, I'm Dr. Penn from Horizon Animal Hospital, and today I would like to talk to you about the importance of good dental hygiene and why regular dog dental appointments are crucial. My assistant and lead tech, JJ, will be helping by asking some questions, and I hope that we're able to help you understand more about why dog dentistry is so important.
Dr. Penn, how does dental health impact the overall health of my dog?
So the mouth being a source of infection, that infection can spread to other parts of the body, leading to infections in other organs such as the liver or the kidneys. So it's important for the overall health to take care of the mouth as well.
How can I care for my dog teeth at home?
So one of the things home dental care, the most important thing is brushing the dog's teeth. There's also a bunch of different types of dog chews and dental treats. An appropriate, of course, brushing and appropriate dog toothpaste is going to be the best thing that we can do. Usually we utilize a toothbrush like this, and there's special enzymatic toothpaste that actually can be swallowed. There are oral vet chews that can also be done and used. The important thing with the chews is you need to make sure that the dog doesn't just swallow the chew. 4 out of 5 dentists say that Trident is good but the Trident gum is not good if they just swallow it. So it's a similar situation here. For example, my dog, he thinks these are just to be inhaled, so they don't work. So I have to brush my dog's teeth.
What are some signs and symptoms of dental disease in dogs?
So that bad breath is probably the number one sign that owners oftentimes see. Dogs may be more reluctant to eat on one side of their mouth. One thing that it usually doesn't do is it doesn't keep them from eating, which is one of the reasons why a lot of dental disease goes unnoticed, because owners are very observant when their dog doesn't eat, but maybe not so much with other things going on inside the mouth.
What are some of the more common dental diseases in dogs?
So periodontal disease is the number one, and that involves along the gum line having inflammation that then leads to bone loss, and the bone loss, as it advances, leads to more and more exposure of the root of the tooth, and just like a tree, if the roots are too exposed, the tooth is likely to be lost.
Why is early detection and diagnosis of dental disease so important?
So early detection obviously can lead to the preservation of teeth and also the preservation of infections that could spread to other parts of the body. Dental care and having regular dental evaluations also allows the veterinarian to monitor for formation of masses that might form in the mouth, as well as some breeds are predisposed to overgrowth of their gums, so the gum disease sometimes can almost like cover the teeth up and need to be treated with surgery.
So how often should my dog's teeth be checked?
I would say in general, annually. There are some dogs that require dental care more frequently. I do have a couple of patients that have to come in every 6 months because of the periodontal disease, and the owner's just not able to keep up with it with brushing alone.
What is a professional dental cleaning like for a dog?
So the night before anesthesia, we have the pet owner pull the food away from the dog, so at midnight, so that they have a fast. They come into the hospital between 7:30 and 8, and we check the patient in. They're given a calming medication, a pre-anesthetic medication prior, and then they're also have an IV catheter placed, and they're put under general anesthesia in order to get a good, thorough dental evaluation.
Do you recommend anesthetic-free dentals?
Absolutely not. That's a very good question. We cannot fully evaluate a dog's mouth without anesthesia. I mean, for one, there's an anesthesia dental probe that we do the x-rays with that costs about $6,000. So the dog cannot bite down on those probes or they'll get ruined. So as you can see, the x-rays allow us to evaluate the roots, also the pulp chamber to see, and then we also look in the bone to see if there's any evidence of bone loss that might indicate infection and the need to have that tooth removed.